Thank you, Honourable Speaker. And I also wish to convey my sincere appreciation to Honourable Alipate Tridol for raising this very, very important question on the effect of cattle diseases on the cattle industry in Fiji. His inquiry highlights a matter of national significance, drawing attention to the challenges faced by our farmers and broader livestock sector, and it was also raised by Honourable Koroila Pasau earlier this week. By bringing this issue to the forefront, Honourable Tidolo has contributed meaningfully to the ongoing effort to strengthen animal health, safeguarding livestock, and the support for sustainable development of the cattle industry, and also to the respect of the movement of livestock within Fiji. Honourable Speaker said the cattle industry remains an integral part of Fiji's agriculture sector, and I support the livestock livelihood of thousands of rural households and contributes to national food security through production of beef and dairy products. Despite its potential, the industry continues to face challenges related to productivity, genetics, farm management practices, and importantly, animal health. Honourable Speaker, sir, Fiji, like many livestock producing countries, faces two endemic cattle diseases that pose risks to herd health and productivity, and this includes brucellosis, which is a significant infectious disease caused by a bacterium that affects the reproductive system of cattle. It leads to abortion, reduced fertility, decreased milk production, and overall poor herd performance, which can create major economic losses to our farmers. The disease spreads through direct contact with infected animal and contaminated materials such as aborted fetus, placenta, or milk. During the last three emergencies of brucellosis in Fiji, 2009, 282 cattle were found with infection and were concentrated in northern Tailebu region and the province of other parts of the province of Tailebu. Controlling brucellosis is a national priority, and efforts include regular testing and slaughter of infected animals, quarantine of infected herds, and movement regulation on cattle to reduce disease transmission. Since brucellosis is zoonotic, it can infect people through unpasteurized milk, handling of reproductive fluids and tissues, and slaughtered animals. So it is essential to use protective clothing, gloves, footwear when visiting or working on infected farms. Brucellosis, bovine tuberculosis is the chronic infection of a disease caused by a bacteria that affects the respiratory system of cattle and could also spread through its entire body. It is typically transmitted through inhalation of bacteria shared by infected animals or through contaminated feed and water. Infected cattle may show signs such as weight loss, chronic cough, reduced milk production, and general weakness although many animals remain asystemic in early stages, meaning they cannot show these symptoms in the early infection stage. Bovine tuberculosis poses serious economic challenges of livestock, Fiji's livestock sector, because it reduces productivity, impacts trade, and requires strict testing and culling programs to control its spread. Between 2018 and 2021, 3,012 cattle in Fiji were found to be infected with tuberculosis, bovine tuberculosis, which causes particular concentration in the Central Division, especially in Tailebu and Naitasiri provinces. Effective management relies on regular herd testing improved farm biosecurity, and cooperations between farmers and veterinary authorities to prevent further transmission and protect both animal and public health. Honourable Speaker, Sir, cattle disease have significantly impacted Fiji's livestock sector, causing economic losses and disruption and disrupting the productivity of the industry. Some impacts of this disease include economic losses where livestock disease reduced productivity by lowering beef and dairy production, increasing mortality, and raising farm production costs. This affects household income, national supply chain, and increase our reliance on imports. Threats to public health, both bovine brucellosis and bovine tuberculosis, are zoonotic in nature. Risks of infection to farmers, veterinarians, and consumers. Ensuring public health is therefore a public central priority to our disease control programs. Honourable Speaker, Sir, outbreaks of disease not only threatens the health of animals, but also affect farmers and their livelihood. The Ministry of Agriculture and Waterways recognizes the strategic importance of this sector and will continue to implement several measures to address the disease challenges, such as strengthening animal health surveillance and diagnostics, national eradication and control programs, genetic improvement and breeding programs, farmers' capacity building, strengthening border control and biosecurity measures, public and private partnership, and industry collaboration in research and climate resilience. Honourable Speaker, the Ministry of Agriculture and Waterways remains fully committed to revitalizing Fiji's cattle sector. Addressing cattle disease challenge is central to this effort through strengthening surveillance, improve veterinary services, farmers' education, enhance biosecurity, and strengthening the sector partnership. I ensure this August House that our farmers and stakeholders, that the Ministry will continue to provide technical support, resources, and the policy leadership needed to safeguard the health of our national cattle herd and drive sustainable growth in the livestock sector. Now, I leave so.